like to thank you all in advance for your respectful participation in the event. Also to inform you that there is time for questions at the end. Our moderator for the evening is Andrew Lawton, an award-winning radio broadcaster from London, Ontario. Please join me in welcoming him to the front to introduce himself, as well as our speakers for the evening. Andrew?
Thank you very much, Michelle, for the invitation, as well as to Students for Life for hosting this great event. One of the things that I strive for on my show is debate and discussion on issues like these, and a lot of different ones. So I think it's great when we can all come together. So I'm very, very grateful for the opportunity to be here to moderate this debate this evening. And I want to give a big round of applause to Michelle for putting this on, please. She paid me to do that, by the way. In fairness, though, it's going to be a great evening tonight. I do ask that you are respectful to this. I didn't actually know the university had a policy on disruption. I hope the policy is don't do it. If so, I think that'll be in the best interest of everyone here. As Michelle mentioned, and as you are aware from the signs, the topic tonight is a very specific one, but a very important one, and that is abortion, human right or human rights violation. We're going to introduce the speakers in a bit more detail later on when they're coming up to speak, but I want to give a bit of a rundown on the format. We have the Campus Outreach Director from the Canadian Centre for Bioethical Reform arguing that abortion is a human rights violation, and that's Maaike Rosendal. And then we have a professor, the Professor Emeritus in the Department of Philosophy here at the University of Toronto, arguing that it is a human right, and that is Dr. and Professor Wayne Sumner. So to both of our debaters, I appreciate very much your willingness to participate in this. Now, in the spirit of discussion, I'm informed that the speakers were going to talk about a lot of the issues that are going to be happening tonight, the debates that are going to be happening this evening, and they actually wanted to have, in the spirit of civility, a discussion, a coffee earlier on, and I understand they did that. Now, I also understand they've been banned from Bar Mercurio, is it? And I think $352 for the tables they broke. So hopefully we'll have a bit more of a civil discussion tonight, but if not, it will be on video, which will be available later on pay-per-view. So thank you very much for both of you for doing that. The format of the debate is going to be a 20-minute opening statement from each of the presenters. And in that time, they'll go over basically why they believe what they believe. And this will be an opportunity for them in an unfettered way to present their arguments to you. Afterwards, they'll have the opportunity to cross-examine one another, which will be a 7-minute exchange back and forth with interjections and requests for follow-up as needed. After that point, we will actually have a closing statement as well as a final rebuttal from both of them, which will last about 15 minutes for each person. And I say about 15 minutes, I'm the one with the timer. So hopefully, if I'm not timing, no one else is, I don't think. And to close up, we'll actually have questions from the audience. And in keeping with the spirit of civility, we ask that all questions are respectful, and we'll give the debaters an opportunity to respond and then respond to each other's responses. So, without further ado, I wanted to get things moving on this evening's big debate. The reason you've all come out here on a chilly Canadian evening. And welcoming up the first presenter is going to be me, and that is Maaike Rosendal. She's the founding member of the Students for Life at the University of Lethbridge, where she served as vice president and as president. She obtained a Bachelor of Social Work from the University of Calgary, and actually joined a pro-life delegation to the United Nations Commission on the Status of Women in New York. Instrumental in starting the Abortion Awareness Project, which employs Canadian Centre for Bioethical Reform projects such as Choice Chain and the Postcard Project. She also joined the staff of that organization in 2012 and is their Campus Outreach Director. So with her opening statement, please welcome Maaike Rosendal.
Good evening, everyone, and thank you, Andrew, for the introduction. Can everyone hear me like this? Yeah? Okay, great. Several years ago, I worked as a community liaison for immigrant services in Lethbridge, Alberta. And I helped new immigrants settle in the town that we lived as they came as immigrants or refugees. And I clearly remember the day that one of my clients called me and said she needed to meet with me. And I said to her, I'll be in next week, let's make an appointment. And she said with panic in her voice, no, I need to meet you now. And so I changed my schedule so that I could meet with her. And as she walked into my office, she indicated to me in her broken English that she was pregnant. Now, all of you can realize that as a new immigrant to Canada, 18 years old, having come from Burma, only with a friend who happened to be her boyfriend unbeknownst to her parents, It was difficult for her. She found out she was pregnant and she did not know what to do. Now, the reason I bring this up is because those of us who are for abortion and those of us who are against abortion can all agree that the circumstances surrounding unwanted pregnancies are often very difficult. And so when I make a case against abortion, I do not belittle or trivialize that. I believe that the voices of these women need to be heard, as they've often confided in me about the circumstances of those kinds of pregnancies. But as I make my case against abortion tonight, I also ask a question. Is abortion the right solution? And does abortion really resolve all of those circumstances that women experience? Will it make a poor woman rich? Will it help her find a safe haven from the domestic abuse she's fleeing while she's also pregnant? Will it address the policies that penalize her for being pregnant, whether in the workplace or in university? And does it challenge the beliefs in society that lead to inequality between men and women and that lead to sex selection abortion? And of course the answer is no. And therefore, as a human rights advocate and a social worker, I reject abortion as a band-aid solution and an indication that we have failed women. But tonight, the question I was asked to answer is whether abortion is a human rights violation. But I can only answer that after we've looked at some facts. And so what I want to do with you tonight is first of all look at what the preborn are, to find out whether fetuses and embryos have moral relevance. And secondly, I want to look at what abortion does, because only then can we answer the question whether or not abortion is a human rights violation. Now, when we look at what the preborn are, we simply need to go back in our own life. We can look at a timeline and we can find out what the preborn are. And the reason I thought of this is because as I was talking with my 4-year-old son the other day, he asked me inquisitively, "Mom, were you 4 once?" And the reason he asked me that is because he is 4. But of course, all of us were once 4. We were all once toddlers. We were all once infants. And we were all once fetuses and embryos. But after we were embryos and fetuses, a process called birth took place, during which we moved from the in utero world to the ex utero world as we traveled through the birth canal. And so in order to find out more about the preborn, I would like to look at the 3 trimesters to tell you a little bit about the development of preborn children. During the 3rd trimester, from 27 to 40 weeks, the fetus can respond to sound and sense changes in light. His or her bones are hardening, but the skull will remain soft and flexible in order to allow for birth. Now during the 2nd trimester, from 13 to 26 weeks, the fetus can swallow and hear, has eyelashes and eyebrows, and early on in that trimester, he or she is already big enough for the mother to feel movement. During the 1st trimester, from 0 to 12 weeks, this is the time during which most development takes place, but also during which most abortions take place in Canada. At 10 weeks, the fetus has finger and toenails, and at 8 weeks, it ends the embryonic stage, because an embryo is what we call the preborn during the first 8 weeks of pregnancy. And at that time, every organ is present, even though he or she is only 1.5 inches long. What I want to do now is show you a video from EHD that shows you a little bit more about prenatal development around 5 or 6 weeks.
By 6 weeks, the cerebral hemispheres are growing disproportionately faster than other sections of the brain. The embryo begins to make spontaneous and reflexive movements. Such movement is necessary to promote normal neuromuscular development. A touch to the mouth area causes the embryo to reflexively withdraw its head. The external ear is beginning to take shape. By 6 weeks, blood cell formation is underway in the liver, where lymphocytes are now present. This type of white blood cell is a key part of the developing immune system. The diaphragm, the primary muscle used in breathing, is largely formed by 6 weeks.
Then moving on, at 3 weeks, the embryo's heart starts beating and settles into a rhythm of pumping blood through the blood vessels. And at 8 days, it implants into the uterine lining. And when we're talking about prenatal development, it's remarkable that we use these, we refer back to the beginning. And we know that because we're talking about 8 days and 3 weeks and 3 months, and that means that we started counting at some point. The question is, when was that? We start counting at fertilization because that is the beginning. That is when the embryo comes into existence. Now that in itself doesn't necessarily say anything. We need to find out what the preborn really are at that time. What the preborn are at that time. And there's 4 things that we can find out about them. The first thing we know is that because of the law of biogenesis, which says that living things produce living things, there has to be a living being after fertilization. It is also living because it is growing, and so by virtue of its growth, we know that it is alive. Now some people might say, but it is just an embryo, it's just a fetus. But those words in itself don't really tell us anything about what it is. It only tells us how old it is, because those are terms that are age classifications. They're also not species specific, because we have elephant embryos, we have dog fetuses. So when someone says it's an embryo or a fetus, it's using a term like infant, toddler, and teenager. In order to find out what it is, we have to ask what its parents are. And that brings me to the second thing we know about the preborn, and that is that they are human. Why? Because species that reproduce sexually reproduce after their own kind. And so because the parents are human, the sperm and the egg cell came from human parents, their offspring has to be human as well. Thirdly, what we know is that the preborn are unique. Why? Because the 23 chromosomes of the father combine with the 23 chromosomes of the mother, and at that moment a new genetic code is created. From that moment on, there is a new distinct human being. Finally, the 4th thing is that we know that it is a whole organism in itself. And so before fertilization, we have human parts, sperm cells and egg cells, but after fertilization, we have a human whole that directs its growth from within in a coordinated manner, and has the inherent capacity to do so by virtue of the kind of thing it is. Now maybe you question whether or not all this is true. You don't have to take my word for it. You can check out medical and embryology textbooks that are being used by nursing students across this country. One of those is More en Passant Before We Are Born, which says this, quote, "Human development is a continuous process that begins when an oocyte from a female is fertilized by a sperm from a male. Although human development is usually divided into prenatal and postnatal periods, development is a continuum that begins at fertilization." What that means is that science teaches us that at the moment of sperm-egg fusion, which we also call fertilization, a new living and unique human being comes into existence. Now some people would say, even if that's the case biologically, there are far too many differences between us and the preborn, and that's why they should not have the right to life. Now I agree with you that there are differences between the preborn and us, but the question is, do they really matter? One of the first differences is the size. So people would say, can you really say that something that is smaller than the period at the end of a sentence is a human being like you and me? Of course it is true that they are smaller than us, but would any of us say that those of us who are bigger have a right to kill those of us who are smaller? Of course not. If that is the case after birth, why would it be any different before birth? So those differences are there, but they're not morally relevant. Other people might say, well, because they're much less developed than we are, they don't have the same abilities or capacities yet, they shouldn't have the right to life yet. But does our level of development really matter? If I look at my own family, my 4-year-old son Jonah is much more developed than my 8-month-old daughter Tisa. Of course he's more developed, but does that change whether or not the one has a right to life or the other doesn't? Does that change how much value they have? No, because human rights are based on the fact that they're a human being. If that's the case after birth, why wouldn't that be the case before birth? Now someone would say, but as long as they're in utero, as long as they're in that environment inside a mother's body, then they should not have a full right to life. But does our environment matter? Does where we are change who we are? All of you came from a different environment than where you are now, and yet you are the same person with the same right to life. So just because the preborn are in a different environment than we are and need that environment to survive, why would that change their humanity? Well, someone might say they're dependent on the mother's body for survival. And of course that is true. But does that really matter? In our society, when people are dependent, we do not say that those around them have less of a responsibility, but in fact we say they have more of a responsibility to ensure the well-being of those who are dependent. And so I would say that dependency is more of an argument against abortion than it is for abortion. Yes, the preborn are dependent, but that does not change the fact that they're a human like you and me. So those differences exist, but they do not alter their humanity. And because those differences are not a good enough reason to end someone's life after birth, why would that be the case before birth? They're smaller than us, they're less developed than us, they're in a different environment than us, and they're more dependent than us because of their age. In our species, when you're of that age, that's where you're supposed to be. That's what you're supposed to look like. And so to say that they should not have the right to life is to discriminate against members of our own species because of their age. Of course, those who defend abortion as a woman's right call themselves pro-choice. But when we talk about a choice, we need to ask ourselves, what is that choice? I am pro-choice when it comes to a lot of things, as long as that choice doesn't harm other people. And so what we need to look at in the abortion debate is what that choice really is. Only then can we find out whether it is a human rights violation or whether it is not. What I'd like to do now is show you, tell you about the abortion procedures that are used in Canada. Now, the Journal of Obstetrics and Gynecology Canada reports that approximately half of the women who seek termination during the first 8 weeks use a medical abortion. And so that happens during the first trimester, which is done with the off-label use of methotrexate, often followed up by misoprostol or by misoprostol alone. And so it's placed in the woman's vagina, which then kills the embryo, and that is how the abortion takes place. Now, interestingly, the National Abortion Federation encourages physicians to explain that though the embryo is very small and may be obscured by blood clots, patients may still see a recognizable body. They also require physicians to get consent from the woman to follow up with a surgical abortion in case the embryo survives. More common, though, is a vacuum aspiration or dilation and curettage abortion, which you can see here. And so what happens is that the cervix of the woman is tightly closed, as it is supposed to be. It is forced open with chemical or osmotic dilators like laminaria, for example, and then a speculum is inserted into the vagina. The blades are open to allow the abortion provider access to visualize the cervix, and then a tube is inserted and attached to a vacuum pump or aspirator, which suctions the developing human being into pieces. The tube is rotated from side to side, from the back to the front, until the flow of tissue ceases. And then it is followed up by the use of a curette to get rid of the remaining tissue. Another abortion that is done is a dilation and evacuation abortion for 15 weeks and upward. Now, women generally undergo 1 to 2 days of cervical dilation for that. And at that time, again, a speculum is inserted to allow access to the cervix, and a grasping instrument like forceps are used to tear the developing human being to pieces. The Society of Obstetrics and Gynecology of Canada's Induced Abortion Guidelines says this: fetal tissue should not be removed forcibly through the cervix, as bone spicules may lacerate the cervix. Whose bone spicules? Not those of the woman, but those of the preborn child. The same society says that a crushing and rotating technique should be used to lessen cervical trauma. What does that look like? This is an abortion tool that is used in Canada. Those are the forceps that are used during an abortion procedure like this. And they're inserted into the woman's vagina, and then an arm is grabbed and twisted and pulled out. And then the abortion provider would go back in and grab a leg and twist it and pull out. That's what a dilation and evacuation procedure looks like. Another abortion done in our country is a D&X, or dilation and extraction. And so the aborted fetus is delivered intact instead of in pieces. Now, the National Abortion Federation, again, has recommendations for physicians and says because the cranium represents the largest and least compressible structure, it often requires decompression. Decompression can be accomplished with forceps or by making an incision at the base of the skull through which the intracranial contents are suctioned. Decompression means that the skull of the child has to be collapsed. And that can be done by forcing scissors into the back of the neck, after which the brains can be sucked out. Another abortion procedure can be done by injection of potassium chloride into the umbilical cord or into the fetal heart. This is abortion. That is what we're talking about tonight. I want to show you the photographic evidence now of the abortion procedures that we are talking about, so that you can see what that looks like. And after that, I will answer whether or not this is a human rights violation. I have Dr. Sumner's book on abortion and moral theory here with me. This is the theory. What you will see now is the practice. This is legal in Canada. And so when we talk about human rights, I briefly want to look at the human rights doctrines that we have in our country and around the globe. Our Charter of Rights and Freedoms says that everyone has the right to life, every individual has the right to equal protection of the law without discrimination based on age. Everyone implies all members of the human family. The United Nations Universal Declaration of Human Rights says this: whereas recognition of the inherent dignity and of the equal and inalienable rights of all members of the human family is the foundation of freedom, justice, and peace in the world, everyone has the right to life, liberty, and security of the person. In order to determine whether abortion is a human right or a human rights violation, we need to look at prenatal development, what we've done, and look at what abortion is. The conclusion is that the preborn scientifically are human beings like you and me. The conclusion is that abortion intentionally and directly ends their life. And because of that, it is a human rights violation. They may be different from us in some ways, but all of us here are different in every imaginable way. But the only thing we have in common is our humanity. And that is what gives humans human rights. In our country, in an attempt to create equality between men and women, we have targeted another group of human beings and deprived them of human rights. Because in Canada, you can have human rights, you just have to be born first. And so the pro-life case against abortion is very simple. It's human rights for all human beings. Human rights should begin where the human begins, and we know that that is fertilization.
Thank you very much. Yes, 20 minutes sometimes falls in the middle of the sentence. I apologize in advance to both speakers, but I have to do this. Thank you very much, Maaike Rosendal. Arguing in favor of abortion as a human right is Dr. and Professor Wayne Sumner. He's a professor emeritus in the Department of Philosophy here at the University of Toronto. His areas of specialization are ethics, political philosophy, and the philosophy of law. He's the author of 5 books ranging from Abortion and Moral Theory, published in 1981, to Assisted Death, A Study in Ethics and Law, published in 2011. He's a fellow of the Royal Society of Canada and winner of the 2009 Molson Prize in Social Sciences and Humanities from the Canada Council for the Arts. Please welcome, with his position, Professor Wayne Sumner.
I'm waiting for this guy.
Starts when you speak.
Okay, I want to begin by thanking Michelle and the club for inviting me to participate in this debate. The debate question before us, broadly speaking, is the morality of abortion. Maybe somewhat more specifically, when, if ever, is an abortion morally justifiable or morally permissible? In my opening statement, I have two aims. First, I aim to show why what I will call the pro-life answer to this question, the answer that Ms. Rosendal has given, may I call you Maaike?
Absolutely.
The answer that Maaike has given cannot be correct. And secondly, I want to explain why this doesn't matter. That is, why it doesn't matter what the correct answer is to that question about the morality of abortion. I have no visuals, graphics, or video to offer. I'm a philosopher. I only bring arguments. So I'm only asking you to listen and to think. I'm going to begin with something that we can all agree on. Certainly, I think something that Maaike and I can agree on, and that is the question before us of the morality of abortion isn't an easy one. It's a complex and difficult one. And I think this is obvious from the very fact of this debate and other debates on the same topic. If the right answer to this question were obvious, then no debate would be either necessary or appropriate. We don't debate the morality of murder or the morality of rape. These are easy questions. We only debate hard questions. More to the present topic, we don't debate the morality of contraception or of infanticide. No one finds contraception morally problematic anymore, though many people used to. And everyone finds infanticide morally indefensible. The morality of abortion is a complex and difficult question because abortion stands in an ambiguous middle ground between these two extremes. Between contraception on the one hand, which is the prevention of pregnancy, the prevention of conception, and infanticide on the other hand, which involves the killing of a newborn infant. Abortion is the something in between those two. And that's what makes it complex and difficult to think about. It's a hard case between two easy cases. We know what we think about the extremes. We find it harder to know what we think about abortion. Is it as innocuous as contraception on the one hand, or is it as serious as infanticide on the other? Or is it perhaps both? Now, I spent many years, in fact decades, longer than I care to think of, teaching ethical issues in philosophy classrooms. And one thing I learned, I think I learned a number of things, but one thing I learned from all of those years is that simple answers to complex ethical questions are almost always wrong. They're wrong because inevitably they ignore or deny some important aspects of the question. They're wrong, that is, because they oversimplify the question. That's why the pro-life answer, Maaike's answer, to our debate question is wrong. It oversimplifies it. Now, I want to take a step back here before going on and take a look at the bigger picture about the moral status of abortion. I want to suggest that the moral status of abortion is determined above all, primarily, by two different factors. One of them is the moral status of fetuses, that is, how much they matter or count for morally. And that's an important question. It's the one that Maaike focused on in her presentation, and it's certainly an important part of the answer to the question of the moral status of abortion. But we mustn't make the mistake of thinking that it's the whole answer. Another factor matters at least as much, and that is the rights of women, especially women with unwanted pregnancies. Women have rights over their own bodies, including the use of those bodies for reproductive purposes. And no position on the morality of abortion, no matter which side you stand on, no position on the morality of abortion can be defended without taking these rights into account. Now, Maaike has focused on the issue of the moral status of the fetus and what follows. I'm going to do the same thing. But I want you to keep in mind that this focus can yield at best only a partial answer to the question of the moral status of abortion, not a complete one. So in that sense, the outcome of tonight's debate, which is going to focus on that issue about the fetus, will not settle morality of abortion. Now, for my purposes in my presentation, I'm going to use the term fetus to cover everything during prenatal development, from a fertilized egg at one extreme to at the beginning of pregnancy, to a baby ready to be born at the end of pregnancy. This isn't technically correct, and Maaike is using the term embryo to cover the first 8 weeks of that development, and that's much more technically correct. It's just easier to use the same term to cover everything we have from the beginning to the end. And her position, her view, is that a fetus at every stage of development, from beginning to end, has the same moral status, and furthermore, it has the same moral status as you and I. Same status as an adult, same rights. So it's equally serious, and abortion is equally serious no matter when it's performed. Now, I just want to note, as a matter of interest, that this view is rejected by most people who think seriously about the issues. Most people think that abortion becomes a more serious matter as the fetus develops. For them, an early abortion in the first trimester is one thing, morally speaking. And for people who take this view, it's pretty much morally comparable to contraception. It's another form of family planning. Whereas a late abortion, let's say in the third trimester, is quite a different matter, morally comparable to infanticide. So recall, the problem is that abortion occupies this ambiguous middle ground between contraception on the one hand and infanticide on the other. On the view that most people take, and the one that I share, abortion gets pulled in both directions. Early abortions are treated as similar to contraception. Late abortions are treated as similar to infanticide. I asked earlier, do we classify abortion with contraception on the one hand or infanticide on the other? This answer, which is shared by many people, including me, is both. We classify early abortions with contraception, late abortions with infanticide. Now, a reality check. Abortion is legal in Canada, and in this country, over 90% of abortions are done in the first trimester, that is in the first 12 weeks. And 97% are done by the end of the 16th week of pregnancy. That fact, the fact that overwhelmingly abortions are done early, combined with the common view that early abortions are less morally problematic than late abortions, is what accounts for, above all, more than anything else, the widespread support in this country for the country's current abortion policy. It's a policy that enjoys such widespread support that even political parties like the Conservatives, who are ideologically opposed to it, dare not raise the issue, because they know that overwhelmingly they'd be attacking a policy which most people support. Now that support would evaporate if most abortions were being done late in pregnancy. But almost none are. And when they are, they're done for the most serious reasons, especially to save the life or health of the mother. Now, what I'm calling here the common view the one I've described a moment ago, responds to the obvious fact that there are enormous differences between what we have at the beginning of pregnancy, a fertilized egg or undifferentiated clump of cells, as Maaike said, about the size of a period at the end of a sentence, and what we have at the end, a baby completely ready to be born. At no period during human development does so much change so quickly. In thinking about the moral status of the fetus, and therefore in thinking about the moral status of abortion, these differences matter. The facts of fetal development can't just be ignored or denied when you're trying to think about what the moral status of the fetus is. And if you take these facts into account, you can't accept a simple view of the morality of abortion. Instead, you will inevitably be led to a view that is more complex by virtue of treating early and late abortions differently. Now, if you take this step, you will then acquire the burden of explaining what it is that happens during fetal development that changes the moral status of the fetus and therefore changes the moral status of abortion. And I don't want to pretend that's an easy thing to do, though it can be done. Maybe in some of my remarks later I'll return to this question. But you get that burden, you acquire that burden, only because you refuse to take the easy way out by ignoring or denying what is obviously morally relevant, namely the developmental changes in the fetus. Simple views avoid answering this question by assigning the same moral status to the fetus throughout its development. That's what makes them simple. But they come at the cost of oversimplifying the issue by ignoring or denying the significance of fetal development. That's why the pro-life answer to our debate question, the answer that Maaike has defended, can't be correct. It's too simple. Now I want to explain why that doesn't matter. So here we need to distinguish two different questions about abortion. The moral question, which is the one we've been discussing so far, is when are abortions morally permissible? The legal question is when should abortions be legally permitted? The moral question is interesting as a debating topic, and I think it's well worth debating because of its complexity as a moral issue. It's hard to think your way through this issue. It's a demanding issue to think about. So we have much to learn from debates of this kind and how to think about the issue of abortion. But the legal question is ultimately the only important one for any woman who is actually facing an unwanted pregnancy. What matters to her is whether she will have legal access to a safe abortion. So we have these two questions, one moral, one legal. It's easy to assume that your answer to the legal question should depend on your answer to the moral one. And this is Maaike's approach. So her legal position is an anti-choice policy on abortion. That is, no abortions should be legally permitted. Her moral position is pro-life. No abortions are morally permissible. So she says, abortions should not be legally permitted because they are morally impermissible. Now I defend a pro-choice legal policy, under which at least some abortions should be legally permitted, especially early ones. So it would seem to follow, if I follow the same procedure, that I must base my legal position on my moral position. My moral position is at least some abortions are morally permissible. If you adopt this procedure, or if you follow this procedure, then the abortion policy you support will depend on which answer you come to about the debate question, about the morality of abortion, or rather, who you think wins the debate tonight. But that's mistaken. In order to defend a pro-choice policy, I don't have to convince you that I'm right about the morality of abortion. I don't have to win the moral debate. The mere fact of the debate is enough. Recall the point I said at the outset that we could all agree on, including Maaike and I. The morality of abortion is a complex, difficult question. it follows that it is a question on which thoughtful, reasonable people can and will disagree. Now, Maaike and I are both thoughtful, reasonable people. But on that question, we disagree. Each of us has attempted to present a reasonable case for the position we hold, one that's supported by reasons. Neither of us has referred to authority or faith or the writings in a book or anything like that to defend our view. We have simply tried to present both of us rational arguments. Now, I think Maaike and I will probably never agree on this question. I don't think it would matter how long we went on discussing it back and forth, we're not going to reach agreement. In that respect, Maaike and I are a microcosm of Canadian society as a whole. Canadians are, on the whole, thoughtful, reasonable people. But they, too, disagree on this question. This is an issue on which the Canadian public is divided. Some, as it happens, a majority, agree with me, but others agree with Maaike. Whichever side we take on this question, we have to recognize that there are people of goodwill and good conscience on the other side. They may disagree with us, but that doesn't make them stupid or willfully blind or perverse. Each of you must decide where you stand on this issue as a matter of your own conscience. That's why you came to this debate, I'm assuming, to think about the issue and decide where you stand. The important question is, how must the law respond to an issue like this on which there is reasonable disagreement? What it mustn't do is to impose the views of one side on those who disagree with them. An anti-choice policy will impose Maaike's views on women who do not share them. If the law prohibits all abortions, then it will prevent women from having an abortion which their own conscience tells them is morally permissible. The only acceptable policy is one which gives every woman with an unwanted pregnancy the freedom to act on the dictates of her own conscience. Those who agree with me about the morality of abortion may seek an abortion because they will not think it's wrong. Those who agree with Maaike will not, because they will think it's wrong. Another way of putting this is to say that only a pro-choice policy can respect the conscience of every woman with an unwanted pregnancy. Section 2 of the Canadian Charter of Rights and Freedoms enumerates a number of fundamental freedoms. The very first of them is freedom of conscience. Only a pro-choice policy can respect women's freedom of conscience. So in deciding the legal question about abortion, whether abortions should be legally permitted, it doesn't matter where you stand on the moral question. Therefore, it doesn't matter who you decide has won the moral debate tonight. All that matters is that the issue is debatable and therefore a matter of reasonable disagreement among thoughtful, conscientious people. At the end of the evening, we will not all agree on the morality of abortion. But the very fact of this debate shows that we should all agree on being pro-choice. Thank you.
And thank you for that, Professor Wayne Sumner. The next part of the evening is a chance for the debaters to actually have to be held to account for the statements they've made. This is not the time where we will take questions from the audience, although stay tuned, that will be happening very shortly. This period is what we call the cross-examination, and the reason we call it that is because it's written on the page here in front of me. And it's when they get the chance to examine each other's positions for 7 minutes, ask as many questions as they'd like. If the answer is meandering a little bit, I might try to bring it back on, but for the most part, this is the time for the cross-examiners. If you've just come into the room, don't be distracted by this. This was not part of either of their theories. I was trying to figure out which side this defended pro-life or pro-choice, and I can't do that. Okay, yeah, there we go. So that is Dr. Sumner's position over there in the graph of some kind. I didn't major in math, I can promise you. The first cross-examination will actually be from Maaike, who will be cross-examining Dr. Sumner. You have 7 minutes. Go ahead.
want to clarify that during cross-examination, we're allowed to interrupt each other and that's not
Yes.
rude, right?
Yes,
Okay.
correct.
Just to clarify that. All right, thank you. Dr. Sumner, can I ask you, do you believe in human rights?
Yes,
Who gets human rights?
mostly humans.
Mostly humans?
Mhm.
Is there anyone else who gets human rights?
I think many human rights equally belong to non-humans, yes.
Can you explain what you mean with that?
Sure, how much explanation do you want? It depends on the right in question. So one basic human right is, for instance, the right not to be made to suffer unnecessarily. I think that that right belongs to virtually every sentient animal. So one problem I have, for instance, with factory farming or the way in which farm animals are often treated is that it causes them to suffer unnecessarily. I think that violates their rights.
So if humans get human rights, why do preborn humans not get human rights?
How long an answer to that question do you want?
What?
I mean, that goes to the point I raised during my presentation, that the burden of a view of the sort that I hold is to show what happens during fetal development by virtue of which a fetus acquires rights but doesn't have it all the way through.
So when would you say that it acquires the right to life?
I have to go back a step. The issue is when it acquires any rights at all.
But the right to life is the most basic of rights. Without the right to life, all other rights are redundant. So
yeah, I'm not denying that the right to life is a pretty serious matter. But I think it's more important to talk about when the fetus becomes a subject of any rights at all, including that one.
okay, so
And this, just to
yeah, sure,
continue this,
yeah.
you asked me the question about whether rights belong to non-humans. And I said yes. And so that raises the question, what does a being or a creature, just to use the most sort of vague phrase, what does a creature have to have in order to have rights of any kind? And
I just want to go on so I cover my question. So I would like to address that in my rebuttal, what you just said, but
I haven't explained my view yet, but
okay. Well,
because you want an answer to the question, why don't fetuses at the beginning have rights whereas they have them later on? I'm trying to answer that question. Do you want me to do that,
Sure,
or
yeah.
do you want to move on?
Yeah, no, go ahead.
Okay, so if I'm asked, well, what in general endows a creature with rights, then my answer to that question is the capacity to suffer. Broadly speaking, sentience, the capacity to feel pleasure or pain, enjoyment, suffering, happiness, unhappiness, and so on. That's what endows any creature, human or non-human, with serious moral status and rights, including the right to life. So this goes back to my point about what happens during fetal development, by virtue of which a fetus acquires rights. That is a matter of the point at which it becomes a sentient being.
Right, okay, so at the same time, in your book at page 54, you say, it will be arbitrary to pick any point during or at the end of gestation as the one at which moral standing is acquired.
Yeah.
Why, if that is arbitrary, why then
No,
could you say...
you're misunderstanding. It's
Okay.
arbitrary to pick a point.
Okay, so
Because-
what's the difference then between...
Hang on, let me finish. It's arbitrary to pick a point because development is so gradual. You can pick a stage, but there's no point such that at 4 o'clock in the afternoon, the fetus doesn't have something, and at 1 minute after 4 it does. That's not the way fetal development works. It's much more gradual and cumulative than that.
So
But if
it's
you want me to
arbitrary
identify a stage during which a fetus acquires sentience and therefore acquires rights, then it's roughly around the stage of viability.
And so, if it's arbitrary to pick a point, why is it not arbitrary to pick a period during which it develops
3 minutes remaining.
the capacity which you believe is important in order to acquire
Because
rights?
I've argued that capacity, it's not arbitrary to select that capacity. And so it can't be arbitrary to identify the stage of development at which the fetus acquires that capacity.
But every person I talk to who's pro-choice has a different opinion about when the preborn gain those rights. So the one
I
says
can
12
only,
weeks.
I can only defend my opinion.
Right, so the one says 12 weeks, the next says 14, the next says 24. Everyone has different reasons for that, and you pick sentience. But why is yours morally superior to everyone else's pro-choice
Because I can
position?
defend sentience as a general criterion for any creature being morally important or having moral rights. And I think the reason that I can defend that is that it answers much better to questions about the rights of non-human animals. Unless you deny entirely that non-human animals have rights, then the question becomes, well, in virtue of what do they have rights? And I think this is by far the most plausible answer to that question. And so what one does is simply take that answer and take it back to fetal development, and it follows that a fetus acquires moral rights or moral status when it acquires that capacity.
Okay. Now, when the rights of different human beings conflict, should a more fundamental right be upheld?
I don't think there's any general answer to that, because you can try to identify rights as more fundamental in the abstract, but infringements of rights,
90 seconds remaining.
infringements of rights may be more or less serious as well. So a minor infringement of a more serious right may not matter so much as a major infringement of a less serious right.
So when we talk about basic human rights, such as the right to life, and you say that a woman's bodily autonomy or a woman's conscience rights is more important than whether or not to pre-born have human rights, aren't you saying that conscience rights or bodily rights are more important than the right to life? Because the one trumps the other.
No, because the point I'm making is that for virtually all of the abortions that are done in Canada, there are only rights on one side of the question.
Legally.
No, morally. There are only
So
rights
the
on one
pre-born
side of the
have
question.
no rights? Even
No,
though
I didn't say that. I said that they acquire rights during the course of fetal development. Of course I think that a 9-month fetus has rights. I just don't think that a fertilized egg has rights.
Okay. Now on page 156 of your book, you say a
30
rough
seconds.
rule of thumb is that late abortion for reasons of fetal abnormality are permissible only in those cases in which euthanasia for defective newborns would also be permissible. So you would say that a woman should have the right to have an abortion if her child has a severe disability,
Absolutely.
but not if she has a child with Down syndrome, it seems, your book says.
As it happens, I think that Down syndrome is not a serious enough anomaly. But I'm not going to quarrel with a woman who chooses not to carry a Down infant to term. But it's all
That's
that
time.
serious.
Thank you very much. The next cross-examination is by Dr. Wayne Sumner to Maaike Rosendal. You have 7 minutes, sir. Go ahead.
I want to return to the issue that Maaike raised, namely, well, she didn't raise it directly, but I raised it in my answer to her, namely what she thinks about the rights of non-human animals. So do you think that any non-human animals have a right to life?
I definitely think that we can discuss that, and that we could include the right to life for non-human animals. But what I would say is that once we start talking about that, shouldn't we first include all people of our own species?
Just answer the question. Do non-human animals have a right to life? And if so, which ones?
So non-human animals would not have human rights.
No, what about a right? Does any non-human animal have a right to life similar to the right to life you think humans have?
No, they don't.
Why not?
Because we have human rights by virtue of the fact that we're human.
So, if we were debating not abortion, but the question of animal rights, and somebody asked you whether non-human animals have any rights, you would say that they don't have rights just because they're not human?
I would say
They just belong to the wrong species?
We distinguish between human rights and animal rights. So the implication of what you just said is that the pro-life position or the human rights claim that I make is speciesist, which is obviously true. I mean, all human rights documents, all human rights claims that we make would say that humans have rights that non-human animals don't.
Do non-human animals, I'm going to repeat the question, do non-human animals have any rights at all?
Yes, they do.
Which ones?
That's why we talk about
which animals and which
but
rights?
We are here tonight, we are here talking about abortion, which deprives the youngest members of our species of the most basic of rights.
I'd like you to answer the question because it bears on the position you're taking on the fetus.
I am answering the question. We can talk about animal rights, but what we're here to discuss is human rights, which deprives people of our species the right to life. So we can start talking about that, but can't we agree that we should first include all members of our own species?
I think that what we should first do is ask you to answer the question, which you still haven't answered.
Okay.
So if animals do not have the sort of rights that humans do, it's just because of their species membership.
Correct.
So you think that species membership is a morally relevant property.
Yes, I do.
Why?
That's what human rights are based on.
Doesn't matter. That's just a label. Why is membership in a particular species morally relevant? Why does the fact that we're in one species get us more rights than creatures that are in a different species?
Why do any humans have human rights at all?
That's not an answer to the, you're
It
answering
is.
my question with a question. Can you just answer the question?
But the point I'm making here is not necessarily, what I'm not getting at is why humans have human rights. The point the pro-life position makes is that if human beings have human rights, which we can all agree on, then shouldn't we acknowledge the rights of the youngest of humans?
Look,
So
you're repeating your view over and over again. You're still not answering my question. How is it that membership in a species is a morally relevant property? You would not accept that membership in a race or a gender is morally relevant in itself. Why is membership in a species morally relevant? Just answer that question.
Right, because if we refer to all those other things, they're exclusive. They exclude people, members of our species, whereas when we have human rights, all humans are safe.
That just assumes that membership in a species is more morally relevant than membership in a race or a gender. That's what I'm asking you to explain. Why is it relevant? What's so great about being human? What is it about being human that gets us so much better rights than other animals?
Well, people obviously have different, the underpinnings of the human rights arguments can be different for different people. And so,
what are they for you?
I believe in the human rights argument partly because of my religious convictions, but that in itself would not dismiss the claim that human beings have human rights.
Okay, look, the point here is that speciesism is the view that takes species membership as morally relevant in itself. Speciesism cannot possibly be a correct moral position. You must be able to point to something about that humans have that non-humans don't have, besides the membership in the species, that makes them special. And whatever you point to is not going to be shared by all fetuses.
But by saying that you need to explain why human beings have human rights. With that, you question all human rights. So then human rights doctrines all go out the window, because if that's irrelevant, why then are we even talking about human rights?
Well, just as a matter of fact, you mentioned human rights documents in your presentation, the Canadian Charter, the UN Declaration, and so on. But you must know that none of them apply to fetuses. You know that for a fact.
Why would you say that?
Because they don't. Canadian abortion is not contrary to the Charter of Rights and Freedoms. On the contrary, it was a Supreme Court decision based on the Charter that legalized abortion in this country.
But the Charter and the documents that I refer to say that everyone and all members of the human species.
No, they don't say, no.
It said all member of the human family is what the United Nations documents say. And so if the preborn are human beings like us, they are members of the human family and therefore should also have the right to life.
You may think they should, but no human rights document actually gives them that status.
Why does that matter?
Well, I'm asking you, why would that be? Despite the language that you yourself quote, why is it universally the case that they aren't included in any of these documents?
Maybe because they aren't recognized as such yet. But not too
Why
long
not?
ago,
Maybe they're onto something that you're not.
But not too long ago, we didn't recognize women.
1 minute remaining.
Women as people having the same rights as men, or African Americans as those who are of a different skin color. And so just because it isn't recognized as such in itself doesn't mean anything. In fact, United Nations documents also recognize that those who, a woman who is pregnant, for example, may not get the death penalty because she's pregnant and because there's another human being present. Why is that? If it's morally irrelevant, then what does it matter?
You make a good case about race and gender. The reason that human rights documents and human rights practice have progressed beyond those exclusions is that it became recognized that women have exactly the same capacities as men do, and non-whites have exactly, the people of color have exactly the same capacities as whites did. So in those cases, the human rights documents, the human rights exclusions were exclusion on the basis of arbitrary claimed differences. But in the case of...
That's time. I'll give Maaike 15 seconds to respond, just because we ended with a question from Dr. Sumner.
What you just what you just talked about that's functionalism. That's capacities that people have. You said people have the same capacities, capabilities that others have, and that is not what human rights are based on. Human rights are based on membership in the human family. And so if you question...
Thank you, Maaike. And thank you to both for that very riveting cross-examination. It's very good that they're able to get into each other's arguments like that. Presently, we're going to have the final rebuttals and closing statements. Each speaker will have the opportunity to give a 15-minute rebuttal of arguments, perhaps a summation of things that were made in the opening statement or closure on items that were mentioned in the rebuttal, or in the cross-examination rather. And then after this period, we'll take questions from the audience. So stay tuned, that part's coming up in just a moment. With the first rebuttal and closing statement, we have Maaike Rosendal.
So having heard Dr. Sumner's argument against the pro-life position and for abortion, it is clear that he recognizes that the preborn are members of the human family, but that doesn't matter because they aren't sentient like you and me early on in pregnancy. Now I want to respond to a few specific things and then to other things that the case that Dr. Sumner makes in his book as well, if I have the time. Now first of all, Dr. Sumner said in his opening statement that it isn't easy to talk about abortion. It isn't easy to find an answer to this, and that several things are very clear, like contraception or infanticide, but abortion is morally ambiguous. Now we need to remember that at one time in history, that was the case for issues that are completely clear to us today. Not too long ago, slavery and women's rights and rights for people of color were morally ambiguous. That was up for discussion in society. So the fact that we are discussing this today in itself doesn't make a point at all. The absence of consensus also doesn't mean the absence of truth. Just because there are many people in society who hold the pro-choice view, that in itself doesn't mean that the pro-choice view is right. Now, when it comes to the moral status of abortion, Dr. Sumner talked about fetuses and embryos, and yes, I do think it is incorrect to only refer to fetuses because that would be like talking about infants and toddlers and only talking about toddlers while we actually also mean infants. And so we should be specific when we talk about age classifications. Those are embryos and fetuses, but most importantly, they're human embryos and fetuses. When it comes to the rights of women, he said that women should have the right to make their own reproductive choices, and that's why looking at what the preborn are will not resolve this question entirely. Women do obviously have the right to do with their body whatever they want, but in the case of a pregnancy, there's another body. There's the body of her offspring. And so while most people do not believe in human rights for the preborn yet, it is not true that people reject this. In fact, the experience of my colleagues and I is that when we take to the street, when we do presentations, people recognize that scientifically the preborn are human like us, and if we believe in human rights, then it logically follows the preborn should have human rights as well. And so just because the majority of Canadians doesn't see that yet, that doesn't mean they won't. They simply haven't grappled with that idea yet. Now, only in Dr. Sumner's view, there's a morally significant difference between younger and older members of our species because some have capacities that the younger don't yet. That's why he talks about sentience. It is not true that embryos before sentience, pre-sentience, and fetuses pre-sentience don't have that capacity yet. They have the inherent capacity for sentience. They just don't have the immediately exercisable capacity for sentience. That would be like saying that there's a criterion after birth that you need and say only once you get that, that's when we'll give you rights. Inherently, you have that capacity as a human being. I talked with a university student some time ago and she said the preborn shouldn't have human rights because they don't have sentience yet or consciousness. And so I asked her, why is it that they don't have that yet? And she said, well, because not enough time has passed yet. And I said, why, sorry, because they haven't developed it yet. And so I said, why is it that they haven't developed it yet? And she said, because not enough time has passed yet. Why is it that not enough time has passed yet? Because the preborn aren't old enough yet to have that capacity that we're talking about. So it is not true that they don't have that capacity. Inherently, they have it because they are human beings. They just can't exercise it yet. They don't have the immediately exercisable capacity. Dr. Sumner says that we look at the development and say it's irrelevant, and that developmentally, the preborn, we have to look at the development of the preborn and base their rights on that. Now, yes, developmentally they are different than us, and I recognize that in my opening statement, but they are not a matter of kind, they are a matter of degree. And so the preborn are different from us because they don't have certain capabilities yet, not because they're not part of our species. After birth, the same is true. People don't have certain abilities yet. Some are less developed than others. That's a difference of degree, not a difference in kind. Dr. Sumner said both of us have tried to make a reasonable case and that we're never going to agree. If someone can explain to me why it is more reasonable to base human rights on anything other than our shared humanity, I will change my view on abortion. But I will want to ask you the question, what is more reasonable? To base human rights on a view that results in what Dr. Sumner calls in his book inevitable fuzziness and allows for the butchering of the youngest of our species.
That's not a quote.
I will pull up the book.
Quoted before butchery.
No, I said inevitable fuzziness.
Yes,
End of quote.
butchery was yours, not mine.
Yes, it was. I'm going to pull up the quote. When we are dealing with the morality of abortion, borderline fuzziness is both inevitable and tolerable, Dr. Sumner says. Why should we base the human rights view on something like that versus a human rights view that says that all human beings are included? Why? Because when we look at the science, that is the only thing that we can determine objectively and scientifically. We don't know when sentience happens exactly. We don't know when viability happens, and that also changes as our technology changes. And so to base it on something as arbitrary as sentience or consciousness or viability is subjective. And so I believe it is much more reasonable to base human rights on the fact that we are human beings. Now, in Dr. Sumner's book, he talks about how abortion is also allowed because it is self-defense. Self-defense defines a category of justifiable homicide, he says. If I kill you in order to repel your murderous attack upon me, it is your life or mine. Why should we believe that the natural condition of pregnancy of a small child residing in his or her mother's womb is analogous to the attack on someone, which then warrants self-defense? Dr. Sumner also compares the preborn to parasites. He says a fetus is parasitic upon a unique individual in a manner in which a newborn infant is not. The parasitic relations will justify late abortion more liberally than infanticide, for they do not occur under the same circumstances. Why should we accept that the natural relationship between a woman and her child is comparable to that between a parasite and the host? If you harm your child within the privacy of your home, that's not okay. And so when people say that abortion is a private act, it's something that women could do because of their freedom of conscience, because of her bodily rights, that argument doesn't go, because what happens in your home still falls under the law. And so even if abortion is a private act, that in itself doesn't justify it. Canadian law even states that you cannot give consent for violence, even if that is done privately. So private interactions still fall under the law. Now, one of the questions I wanted to ask Dr. Sumner is why we should give his worldview any serious consideration when discussing the right to life. Because I don't believe that it is any more reasonable to make that kind of case than it is to make our case. In order to refute the pro-life position of human rights for all human beings, Dr. Sumner needs to present obvious, logical, and objective reasons that make the case for why we should rescind not just the full right to life, but also why we should rescind the right not to be killed. Because when we're talking about abortion, this is not just about someone having the right to life or not having the right to life. When we're talking about this, it means that people no longer have the right not to be killed. And as a result of that, human beings are decapitated, dismembered, and disemboweled. The final point that Dr. Sumner made is that the pro-choice position is the right one, because that way women can choose to have an abortion if they want to, and that way at least they have that right to do so. But there can be and is no neutrality when it comes to abortion. Either the law allows it to happen, or the law says it is wrong. And so there can be no neutrality. To say it is pro-choice and so people can do whatever they want, that still allows for a practice which deprives the youngest of our kind of the right to life. Saying that there should be pro-choice legislation is like saying I'm against slavery, but we can't have a law on that, so you can have a slave if you believe it's right, and I won't have one because I believe it's wrong. If something is morally wrong, it should be wrong for everyone. If it is wrong to take the right to life from members of the human family, then that should be wrong in our country as well. I have 6 more minutes.
You don't have to use them. I promise I won't use all of mine.
Now, often people would say that, sure, the preborn are human beings like you and me, but they are not persons. They do not have the right to life because they're not persons. They don't have sentience yet, or they don't have criteria that we believe are necessary in order to have personhood. But when we look at history, when we look at the history of personhood, we know that that's exclusionary language, that personhood is always used to exclude human beings rather than include human beings. In the 18th century, Virginia Supreme Court ruled that in the eyes of the law, the slave is not a person. In 1881, American Law Review said that an Indian is not a person within the meaning of the Constitution. In 1909, a British voting right case stated that the statutory word person did not, in these circumstances, include women. And then in 1936, the German Supreme Court refused to recognize Jews as persons in the legal sense. Today, in our country, quote, the law of Canada does not recognize the unborn child as a legal person possessing rights. That was a ruling by the Canadian Supreme Court in 1997. What we see is that when you divorce humanity from personhood, inevitably human beings get killed. When we look at history, we see that if we do not give human rights to all human beings, people are harmed, we see genocides, we see large amounts of people harmed and killed. And so the same happens in our country today, where we say that it's not good enough to be a human being, you also have to have something else. And in this case, it's sentience. Other people might say it's a heartbeat or consciousness or whatever that is. Other people would go all the way and say that you have to be born first. And so when we deny human rights to some human beings, that is when human rights violations happen. That happened in the past when we said you had to be of a certain gender or a certain skin color or a certain ethnicity. And that it's happening today when we say you have to be developed up to the point that we think is important. Why is it reasonable? Why is it better to exclude some human beings, as Dr. Sumner argues, versus including all human beings, which makes sure everyone is safe? In a pluralistic society like ours, where we have Muslims and Christians and Buddhists and Hindus and secular people without religious beliefs, why shouldn't we base human rights on something that we can determine objectively? That is the fact that you're a member of the human family. I showed that to you scientifically, and so my case tonight is if you believe in human rights, and the preborn are human beings like you and me, then doesn't it logically follow that they should have human rights as well? Thank you.
Thank you, Maaike. Rosendal, with his rebuttal and closing statement, 15 minutes goes to Professor Wayne Sumner. And then we get your questions after.
Your turn is coming. Be patient, be patient. All right, I said in my opening statement that the problem with Maaike's view is it's too simple. I want to talk about the ways in which one might defend a simple view like that. Simple in the sense that it simply assigns the same moral status to embryos or fetuses throughout fetal development. And there are, as far as I can make out, there are only two ways of doing that, of mounting a defense of that sort of view, both of which I think Maaike has actually defended tonight or articulated tonight. One is what we're looking for is some property that fetuses have that confers on them full moral status or a full set of moral rights, including the right to life. So one way to defend the simple view is to find some status conferring property that the fetus has equally throughout pregnancy. And then if you base rights on that, then of course the fetus will have the same set of rights equally throughout its development. For Maaike, this is the property of being human. All fetuses matter equally because they're equally human. Being human here is just a matter of membership in a species, a matter of being Homo sapiens. Now, I think this cannot possibly be an adequate answer. And to see why, I want to go back to the animal rights debate that I was interrogating Maaike on in the cross-examination. So we have a question in the animal rights debate that's analogous to the question we're debating tonight. Here we're asking, do fetuses matter morally? Do fetuses have moral rights? Do fetuses have moral status? In the animal rights debate, the question is, do non-human animals matter morally? Do they have moral rights? Now, it cannot be an adequate answer to that question that they don't have moral rights or they don't matter morally simply because they're not human, simply because they belong to a different species. We know that to begin with. We're asking, after all, about non-human animals and what their rights are, and what their status is. To repeat that they're not human is hardly an answer to that question. Instead, if you want to give an answer to that question, then you need to first identify whatever property it is in humans that you think matters. Whatever it is about us that gets us moral rights. It can't be our species membership. It can't just be the fact that we're human. It's got to be something else that we have, in virtue of which we have moral rights. Now, as Maaike mentioned, various people advance various candidates for that status conferring property for us. Some focus on capacities like rationality, or language use, or self-consciousness, or whatever. Whatever criterion you focus on here, whichever one you select, will give a different answer to the question, which non-human animals have rights. But every answer will allow some of them to have rights. I happen to favor a pretty low bar for having moral status or moral rights. One that I mentioned in the cross-examination. For me, sentience is enough. The capacity for pleasure, pain, enjoyment, suffering, happiness, unhappiness. That's enough. Any creature that has that capacity has some moral standing in virtue of having that capacity. But you don't have to agree with me on that. You just have to agree that you've got to focus on something about us that gives us these rights, apart from just being members of a particular species. That's arbitrary. That's morally arbitrary. Whichever property you select, whether it's rationality, language use, consciousness, sentience, there will be two inevitable implications. First, some non-human animals will have it, and therefore they will have moral rights. Second, some humans will lack it, and therefore they won't. Whatever the criterion you select, early fetuses will not have it. Any defensible view you adopt on the animal rights question will have the implication that fetuses early in pregnancy, early in gestation, will lack the status conferring property. And so it becomes impossible then to defend this simple view about the moral status of fetuses. Inevitably, you will be drawn to the view that early fetuses and late fetuses differ in their moral standing, their moral status. And you will be drawn to the view that early and late abortions are therefore also morally different. So I said that's one way to defend the simple view, which I think cannot possibly succeed. The other way is to agree with someone on my side of the question that the fetus acquires some status conferring property during pregnancy. Let's assume it's sentience just for the purpose of the argument. It doesn't matter what it is. Something the fetus doesn't have at the beginning, does have at the end, therefore acquires somewhere in the developmental process. And then to argue that the fetus has the potential to develop this capacity from the beginning. And it's in virtue of that potential that it has moral rights. Now, that potential it has equally all the way through pregnancy, let's assume, because the potential right from day one. So therefore, it will have rights on this basis from day one. Based on rights on potentiality, not actually having the property, whatever it is, develop it. But this involves an obvious fallacy. The fallacy is that having the potential to acquire rights later doesn't confer rights on you now. If you have the potential to acquire rights later, then you will acquire the rights whenever you develop the capacity in question. But you don't get the rights before that potential has been actualized. Consider this. An infant has the potential to acquire voting rights. That is, left to develop, it will acquire the minimum age to vote and will acquire the right to vote. That doesn't mean that infants have voting rights as infants. They'll get their rights when the potential has been realized or actualized. It's the same for fetuses. They will acquire the rights whenever they acquire whatever status conferring property you have selected as the one that's relevant. Merely having the potential from the beginning isn't enough to give them the rights from the beginning. So, since those are the only two ways I can think of to defend the simple view that confers the same status on fetuses throughout, I don't think it can be done. I don't think there's any rational case that can actually be made for the view that Maaike is defending. Nonetheless, I want to quarrel with her on one significant point. I think she made a reasonable case for her view, in the sense that I outlined before. She advanced reasons for it. I don't think they're good reasons. I don't think they're sufficient reasons. That's what I'm arguing now. I think she's wrong. But nonetheless, she made a reasonable case. She seems rather skeptical about whether I've made a reasonable case for my side of the moral question. I kind of take umbrage at that, because I think I'm a reasonable kind of guy, and I am offering reasons and arguments here, not doing anything else. This is, as I argued earlier, a site of what I call reasonable disagreement. This is a case in which we simply have to accept the fact of pluralism, a pluralism of moral views among the Canadian public. People are just going to disagree about this. They're going to come to different conclusions after searching their own consciences and thinking about the issue as thoroughly and carefully as they can. They're simply going to come to different conclusions. And so I return to my earlier point. What's the law supposed to do when that's the case, when it's confronted with that kind of reasonable pluralism? Is it supposed to take the view of one side and impose it on the other? I think that's completely unacceptable in a society that values freedom of conscience. A pro-life policy does that. A pro-choice policy does not. It does not impose my view on Maaike. It doesn't force her to have an abortion when she becomes pregnant. It simply allows her to make up her own mind, whether she will or not, and allows every woman in this room to make up her own mind, whether she will or not. That's the respect in which pro-choice policy doesn't require settling the moral debate. Maaike's favorite policy does. In order for her policy to be the right one, she has to be able to establish to everyone's satisfaction her side of the moral question. I don't have to do that. I just have to allow that people can come to, reasonable people can come to different conclusions about it. And a pro-choice policy follows from that fact alone. So it's an important asymmetry between, not between our moral views, because we're obviously each of us on opposite sides of the moral views. There's an important asymmetry between the legal policies we favor. Mine is the one that protects freedom of conscience. Hers is the one that imposes a certain moral view about abortion on the consciences of women who disagree with that, who reject it, who think otherwise. That's what prohibiting abortion does. And I think it's, I can't find words strong enough, not just disagreeable, but repugnant to do that in a free society. Thank you.
The final stage of this debate for this evening is going to be the question period. At this point, though, I'd like to thank both Maaike Rosendal and Professor Wayne Sumner for their arguments and debate. And let's be honest, with a clash, it really exposes, I think, both sides of the argument to a positive light. Understandably, a lot of people may have questions in this room for the people debating. And the way we're going to do this is every question will be capped at about 45 seconds. So if you have a lengthy preamble to your question, simplest solution is don't. Try to get to the premise of your question and the question very quickly. The debater to whom you address your question, it will be one, not both, will have 2 minutes to respond. And then after that, the opponent will have 1 minute to rebut that answer. We're going to, as best as we can, alternate the questions. So if anyone does have a question, please form a line on this side. And I'll ask the wonderful microphone stand to please ask people. But a wonderful object, a wonderful object. Ask her to, before you bring people up, just try your best to ascertain whether or not the person is addressing Maaike or Dr. Sumner. If we reach a point in the allotted time for questions where there are only questions for one debater remaining, we will proceed as such. So if you notice that one person is getting more questions, try to ask questions to the other side. So the start of this is going to be 2 minutes for the person who's responding initially, and then 1 minute for the rebuttal. And the first question, next question.
The viability of a human fetus requires its dependence on the women. Do you think it's morally permissible for one, either the fetus or the women, one entity, moral privileges to trump another?
That's a great question, and that is ultimately what this debate is about, isn't it? If the preborn are human beings like you and me, which we scientifically know they are, then there's a clash of rights, right? There's the right to life for human beings, and then there's a right to bodily autonomy or the right of conscience, like freedom of conscience, like Dr. Sumner would say. We have to ask which right is more fundamental, because the more fundamental right would trump the other right. And so as difficult as an unwanted pregnancy may be, for the woman there's bodily autonomy, there's 9 months of inconvenience in a difficult pregnancy, but for the child what is at stake is his or her life. And so in our society, people's rights are trumped all the time when someone else's right is more important. So yes, I do believe that would be right. We do that in our society all the time. And so when it comes to the preborn, if we have to have the right to life versus the right to bodily autonomy, the right to life is more important, and that's why that one should be upheld.
Thank you. Maaike, a response, rebuttal from Dr. Sumner?
Well, my view in a way is easier to articulate on this than Maaike's is, because I do think that what I've argued is that in the case of early abortions, there's no conflict of rights. The only rights in play are a woman's rights. A fetus does not have any rights up to that point. The only cases in which one could, on the view that I'm defending, the only cases you could construct in which there is actually a conflict of rights would be abortions relatively late in pregnancy, where the standard practice in Canada now is to require a very serious indication in order to perform an abortion, generally speaking a threat to the woman. And in those cases, even though the abortion will certainly result in the death of the fetus, standard medical practice will still permit it in order to protect the woman's life or health. So those are cases of conflicts of rights that get resolved, as I think they should, in favor of the woman, not the fetus. But as I said in my
That's time, sorry. The next question will be for you, though. So, is your question for Dr. Sumner?
I'll finish the sentence then.
Okay. Is your question for Dr. Sumner? Yeah. Okay. Please proceed.
How do you logically object to someone or a society that argues for afterbirth abortion or infanticide when a newborn baby has no self-awareness, is completely dependent, has little to no capabilities, and can easily be a burden upon society?
Thank you. Dr. Sumner.
Well, what the view I defended was that you acquire rights when you become sentient, and babies are certainly sentient, so I have no problem with saying that they have serious rights.
Do you wish to end your time there?
Yep, that's it.
Maaike, you still do get a minute, though.
I think that's a relevant question, because the minute we start rescinding the right to life and the right not to be killed from some human beings, there's really no end. Right now, we're talking about sentience, but what if someone's definition is different? What if it's afterbirth? What if it is being able to walk or being able to be completely independent? Once we start taking human rights away from some human beings, then there's really no end. And so that's why I think that's a fair question, which is obviously out of the question if all human beings have human rights.
Thank you, Maaike. The next question we'll take will be for Maaike. Does that fit yours? Excellent.
Maaike, you talked about personhood in your closing remarks. I find that when I talk to people who identify as pro-life, it's very intuitive for them to assign personhood like at the stage of fertilization. When I talk to people who identify as pro-choice, it's just as intuitive to assign personhood in my field of study, it's usually consciousness. So can you just speak a little bit more to why we should assign personhood at fertilization?
Thank you, Maaike.
That's a great question, thank you. My question would be, which one is more reasonable? And I gave some examples from history which showed that once we start divorcing humanity from personhood, then people inevitably get killed. Human beings, members of our species, get harmed and killed. And so what is more reasonable, to grant personhood to all members of our species, or to grant personhood to people who meet the criteria that we have come up with in our society at that time? Those are all subjective. Those will be different from different people, but the one that can be determined objectively and scientifically is that you're a member of our species. And so the personhood concept is always exclusionary. It is never used, it has never been used in the history of humankind to include human beings. It's always used by the stronger to exclude the weaker, and that's why it's so dangerous.
Thank you, Maaike. Professor Sumner.
Yeah, again, I keep criticizing Maaike for having simple views. It's a simple view to identify being a person with being human, to take species membership as the marker of being a person. Personhood in the sense in which it's relevant here isn't a scientific category, it's a moral category. It means you're the kind of entity, the kind of thing that has become morally important. And to simply assume that what makes you morally important is being human is, as I suggested, completely arbitrary. So I think you can use the term, personhood, or what it is to become a person, as a kind of marker for what it is to acquire serious rights. And that opens up the question, well, what is it about something that gains the thing that status? I'm on your side. I tend to agree with you that it's something like consciousness or sentience, but absolutely it can't just be being a member of the species. That just can't be the right answer.
Thank you very much. The next question goes to Dr. Sumner.
I'm for fertilization.
We can't take follow-ups.
Professor Sumner.
Okay, I misidentified the field that you were talking about, okay? Sorry about that.
Professor Sumner, your main argument tonight was you're also debating against Maaike, saying animals are humans, but like the debate, was it abortion debate? And I don't see why that argument is valid to argue, because animals aren't clearly humans. Do humans conceive and have animals? No, animals conceive to have animals. So I don't see how the argument was a good example against abortion. And also, animals, I agree, they should have rights, but if we think they should have rights, why don't we go to the Supreme Court and have animal rights? Human rights are humans, animal rights are animal rights. I don't see how that's a valid argument.
Professor Sumner.
I hope I never said that animals are humans. I don't think I ever said that. So I'm going to disregard the first part of the question. I think you must have just misheard me. I did say that animals have rights, and they have rights in virtue of something about them that makes them morally important, and it can't be just the membership in the species. Cats don't have rights because they're cats. Dogs don't have rights because they're dogs. Humans don't have rights just because they're humans. So I think that, again, in this case, what's imperative is to start to sort of think seriously about this, not just to take the glib, simple answer of, humans have rights because they're human, and start to actually grapple with the question of what it is that earns anything rights. And then I think you'll see that there are certain plausible markers in virtue of which we think. You said yourself, you think animals have rights, you think humans have rights, you think animals have rights. What is it they share in virtue of which they all have rights? And I mentioned earlier various possible answers to that question. Like there are better answers, worse answers. I've got an answer to it. But that is the right question to be asking. You know, what is it that humans and non-humans share in virtue of which they all have rights, serious rights, including the right to life or the right not to be made to suffer. But just settling on the fact that they're humans or that animals are non-humans, just absolutely, it's just arbitrary, shallow. It can't be the right answer.
Thank you, Professor Sumner. Maaike?
When Dr. Sumner says it can't be the right answer, says who? Based on what? Why is it arbitrary to say that human beings have human rights? Why is membership of the human family arbitrary or more arbitrary than saying that you need to have sentience first? That is an arbitrary characteristic that a lot of people wouldn't agree with, whereas membership of the human family, human rights for human beings, is something that we can all agree with. My question would also be that saying that sentience is what you need is also speciesist. It also favors our species unfairly because it excludes a lot of non-human animals. And so why wouldn't we pick something like the ability to climb a tree or to have huge jaws or claws? If we're talking about speciesist or arbitrary things, why is sentience not arbitrary? We're still favoring a human characteristic, and I would say that it's more reasonable to say just being human is what gives you human rights.
Thank you, Maaike. The next question will be one directed to Maaike. Is that yours?
Yeah.
Excellent.
So
Working out well.
you mentioned that there was a differentiation between humans and animals often, but wouldn't humans also count as animals? And if that's the case, then do you agree that when another animal is pregnant, for example, my dog, and I kill its babies, it's just equally wrong as killing a human child? Do you think that they're both equally wrong? And if not, why is that?
Thank you. Maaike?
So one of the first things I would appeal to is intuition. So if you saw a baby and a cat crawling towards a busy road, which one would you go say first?
The baby.
The baby. Because it's a member of our species. Because we look out for the well-being of members of our species, especially those who are dependent and vulnerable. And so by me saying that the preborn are human and should therefore have human rights is no different than saying a toddler or an infant or a teenager is a human and should therefore have human rights. And so I think it's fair to discuss animal rights and to include those in some of our definitions. But like I said earlier, couldn't we first agree that all members of our species should be protected? When we protect sea turtles, we don't just protect adult sea turtles, we also protect sea turtle eggs. And so if we would do that for non-human animals, shouldn't we do the same for our species and protect all members of our kind?
Thank you, Maaike. Dr. Sumner?
Well, finally something we agree on. So if I saw the baby and the cat crawling toward the traffic, I'd save the baby too. So just for the record, I'm not anti-baby. However, I think, and the reason for that, I think, is that we do, and I think rightly do, privilege the members of our species in terms of our moral attitudes toward them in certain ways. But that doesn't deny that non-human animals, including that kitten, also have rights. Their rights may not be, in many respects, as serious as ours, but nonetheless they do have rights. And if they do have rights, then once again, species membership can't be the marker for having rights, because members of other species have rights. It's got to be in virtue of something else. I've explained, I won't bother explaining all over again, what it is I think that is the basis of those rights.
That's time, sorry.
All right.
The next question goes to Dr. Sumner.
Which is pretty much picking up where we left off. I'm very interested in hearing more about your argument about sentience there. You recognize the, what you call the potential for sentience in a preborn child before a certain age in pregnancy, though it's not like it's a surprise that a human being would develop that sentience at a certain age, but the capacity doesn't seem relevant. I guess my question would be, why, you also described sentience as a low bar.
Yes.
What do you mean by sentience? Why is that criteria morally relevant? And why should people listen to that criteria instead of a lower or higher bar?
Okay, thank you. That's a great question. So I'll do my best with it in 2 minutes. What do I mean by sentience? I did define it a couple of times. I do mean the capacity for at least pleasure or pain, enjoyment or suffering, happiness or unhappiness. It's basically a matter of affect, a capacity for feeling It's a capacity for being hurt. And why do I think that's morally relevant? Because I think that suffering is morally relevant. I think that one of the clearest duties we have is a duty not to make creatures suffer unnecessarily. And that's the basis of all humane legislation having to do with non-human animals. The most basic duty we have as far as non-human animals is concerned is not to make them suffer. So sentience is to my mind the morally relevant marker, because suffering is undeniably morally relevant itself. It's something in a creature that matters, that requires a response on our part, either to prevent it, or if we can't prevent it, to alleviate it. Suffering matters. Suffering is a matter of sentience. That's why sentience matters. There's nothing arbitrary, morally arbitrary about that. It goes to the very bottom of what morality is all about.
Thank you, Professor. Professor, your rebuttal, Maaike.
Dr. Sumner and I obviously agree that we should do everything we can to prevent suffering and to help the people around us who are suffering. But a just society alleviates suffering, does not eliminate the sufferers. We should help people in every way we can, but we don't do that by killing them or allowing for their right to life and their right not to be killed to be rescinded. Now, when Dr. Sumner says that sentience is a low bar, I would completely disagree. This would allow for abortion up to 23, 24 weeks, depending on when viability is. But the images you saw in the video all included that. And so Dr. Fellows, for example, in London, who's a late-term abortionist, won't do abortions past 23 weeks and 6 days. And yet Dr. Sumner's view would allow for abortions way past that. And even despite his view, he would say that we can't impose our beliefs on other people, and so women should be able to have an abortion whenever, which goes past sentience.
Are there any questions of the remaining querents who would like to direct their question to Maaike? Okay, we'll take one from there.
Okay, so Maaike, when you discuss that we're talking about everybody having the right to be safe and not to suffer, then why should we take the rights of abortion today, in which Lisa Haddett states in her debate that 15% of women suffer maternal death and 60% will suffer from lifelong complications of unsafe abortions? So how can you justify taking away the rationale to competent and safe women to seek a safe abortion?
Thank you, Maaike.
Thank you for your question. The term safe abortion implies something. Safe abortion implies that no one gets hurt in the process. But during an abortion, the right to life is being taken away from another human being. So abortion, to start with, is never safe for preborn human beings because it ends their life. Secondly, if something is wrong, shouldn't it be wrong for everyone? Just because some people are still going to do it, does that mean we should allow for it? If there are people who are going to engage in domestic violence and they get hurt in the process, would we ever say that we should set up centers where they could do that so they don't get hurt themselves? No, because we know that domestic violence is wrong, and so we don't allow for that in our society. The same would apply to abortion. If that takes the life of another human being, just because other people might still do it, still choose to do that, we still shouldn't allow it. Just like it is now unconceivable, unthinkable that we would end the life of a born child by drowning her in the bathtub. Our goal at CCBR is to educate people about the humanity of preborn children and the inhumanity of abortion, so that abortion becomes unthinkable in the same way.
Thank you, Maaike. Your rebuttal, Professor Sumner.
Yeah, the pro-life movement is sometimes characterized, and I always thought it was a misleading characterization, as caring a lot more about fetuses than about women. But I'm beginning to hear that. It's true that countries that prohibit abortion will experience a much higher degree of mortality and morbidity on the part of women who are seeking illegal and unsafe abortions. And that matters a lot. That matters to me more than anything else. Now, for Maaike, because an abortion always results in the death of something that she thinks always has moral rights, then it's the woman's problem. If she decides to go ahead and do something that's wrong, well, too bad for her. But I just think that's callous. I really think that's callous. That just disregards what happens, the realities of what happened to women, what happens to women in places that prohibit abortion. I think we're
Thank
very
you,
lucky.
Professor. The next question for Professor Sumner.
Professor Sumner, if sentience gives rights to another being, then would you agree that animals such as a cow could have sentience? And if so, would you agree that your pro-choice stance would take the choice away from all of us to eat a hamburger, but allow us to kill another human being?
Professor Sumner.
Okay, now before I start answering that, I want to respond to a point that Maaike made earlier. She claimed that on my view, I would be willing to justify abortions much later than viability. I want to make it very clear that for me, the acquisition of sentience is around that stage of viability. So for me, thereafter, abortions can be done only for very serious reasons. I am drawing not a line, but a boundary around that period. So I don't quite understand why she thinks that I would permit abortions much later than that. As for sentience and animals, I think that, yes, of course cows are sentient, and cows and other animals suffer in the process by which they become our food. And I think that matters. For more than 25 years I was vegetarian on that basis. But I do think it has to be voluntary. I don't think that I wouldn't take upon myself the right to legislate vegetarianism for everyone, even though it would reduce animal suffering. In this instance, I would much prefer to work through education and consciousness raising rather than coercion. So in that respect, I feel the same way about not compelling vegetarianism as I do about not compelling women not to have abortions.
Thank you, Professor. Maaike.
The reason I said that is because Dr. Sumner can't have it both ways. On the one side, he argues that sentience is when a preborn human being gains moral standing or relevance. At the same time, he says that the pro-choice position and pro-choice legislation would allow women freedom of conscience. Pro-choice legislation would allow then for abortion during all 9 months of pregnancy.
No.
So then sentience
No, that's just not true.
So then
Maaike's rebuttal.
sentience is irrelevant. When it comes to the difference, we were talking about a cow who is sentient, and yes, there are preborn who are not sentient. That would mean that it would be okay to that it would be wrong to eat a beef burger, but it would be okay to eat an embryo burger because it's not sentient. And so if there's no moral relevance between that sentient cow and the pre-sentient embryo, we should have no problem with that. But we would all intuitively feel that that's not the case.
Thank you, Maaike. The next question for Maaike.
Hi, Maaike. So you discussed kind of your issue with assigning personhood. So you explained how your problem with it is that personhood was denied from women at one point in time, denied from slaves, which we now know to be wrong, or I hope we now think that's wrong. But don't you think that it should be, that personhood should be kind of assigned on like a case-by-case basis? So how can you say that just because those things were wrong, that denying personhood from an embryo is necessarily wrong as well?
Maaike?
If we decide who should get personhood on a case-by-case basis, there would probably still be people in our society who believe that women shouldn't have personhood. There would probably still be people in the world who would say that Jews shouldn't have personhood or people of color shouldn't. And so if we know that something is wrong, why should we allow it up to a case-by-case basis scenario when we can see from history what happens when we allow for that, when we exclude certain human beings? If human beings have human rights, then why does it matter that we differ in other ways? That's the only thing we share. That's the only thing we have in common. And so it's not just my issue with the personhood discussion, but is looking at history and seeing what happens when we take those two things apart.
Thank you, Maaike. Professor.
Now your question's very well taken, because you're challenging the parallelism between the exclusion of women and exclusion of people of color on the one hand, exclusion of early fetuses on the other, and asking whether that's all on the same basis. And I think that's a perfectly good question, because the reason we no longer draw lines of discrimination on basis of gender or race is that we recognize that individuals on both sides of those lines are similar in every morally relevant respect. So the question is, does that apply to fetuses as well? The differences between a fertilized egg on the one hand and a 9-month fetus about to be born on the other are a lot more obvious and obviously morally relevant than the differences between men and women or between blacks and whites.
Thank you, Professor. Next question to Professor Sumner.
You said two things that really struck me, Professor Sumner, during the talk. The first one was your opening, where you said you drew two stark parallels between, not parallels, but two stark examples of contraception and infanticide. The first is something which is unarguably not an issue, and the second, which is something which is unarguably or very difficult to argue a horror.
Right.
But historically, a lot of societies have not had that reaction to infanticide.
Get your question, please.
Yes. If we've discovered a society with a group of people who thought infanticide was not morally wrong, who would get to decide that they should not have that view, or that view should not be done by them?
Thank you, Professor.
Well, I don't know how to answer that because the case is a bit too sort of abstract and vague. I mean, if we came across some country somewhere in which infanticide was widely practiced, who would get to decide that?
Well, you said that the pro-choice position doesn't force their opinion on anybody. My question was, if we were to come up with a group of people, or even a specific person who decided that infanticide was not morally wrong to them,
Yeah.
who should get to decide? Should
So-
it be the government? Should it be the...
Okay, well, who should get to decide is kind of a red herring here, because if it was another society, then it's probably them who get to decide, because we can't impose our laws and our practices on sovereign nations elsewhere. But I thought that you were making a slightly different point, that I've based my pro-choice policy on the claim that there is reasonable disagreement over the status of abortion. So I thought maybe you were asking, well, what if there turned out to be reasonable disagreement about the status of infanticide, right? Something like that. And if there was, then yeah, I think that would change the equation, but there isn't. Again, we're talking about domestic policy here, and I said, look, Canadians are divided about the morality of abortion. They're not divided about the morality of infanticide. On that issue, there's only one side that has any respectable case. So I don't think that there's going to be any possibility of extending the same basis for a pro-choice position from abortion to infanticide, or even, I think, to late abortions.
Thank you, Professor. Maaike. Thank you.
I'm not sure whether to respond to the question or to what Dr. Sumner said.
Whatever you want.
I think it's a very important question because it shows that once we start excluding some human beings, who gets to decide whether we shouldn't exclude another group of human beings? And there's a lot of criteria, a lot of things about the infants that are very similar to fetuses and embryos. They're dependent, they need adults to survive, they need to be taken care of, they're not very developed. If it is wrong to kill them for those reasons, why would it not be wrong to kill the preborn for those reasons? And so when it comes to circumstances like poverty, or when people say, well, in that case, abortion should be okay, my question is always that. If we don't do that after birth for those reasons, why should we do it before birth for those reasons?
Thank you. In the interest of time, as we are running a bit late, would the panelists object to restricting answers to the initial questions to 1 minute?
Yeah, sure.
Okay.
I mean, whatever, yeah. I think we should get all the questions.
Yeah,
However we can get all the questions.
Absolutely. So 1 minute answers and 1 minute.
I don't myself care how long we go.
All right. Go ahead.
Hi. So I work in cell biology.
Your question's for Maaike, correct?
Yes.
Okay.
So in cell biology, we work with, among other things, tumor cells, like tumor cell lines. And they are human tumor cell lines. They are unquestionably human. They are not mice cell lines. They are not ape cell lines. They are human. So my question is, do you grant these tumor cells human rights, such as, of course, the right to life, but of course also, for instance, the right to education? And if not, why not?
Thank you. Maaike.
That's a great question. So human tumor cell lines with human DNA obviously share characteristic that human beings before birth have as well. They have human DNA. But the difference between them and even the early embryo is that the embryo is a human organism that directs its growth from within and acts in a coordinated manner. And if left in the environment it's supposed to be in our species, will just move to the next and more mature stage of development. That will not happen with tumor cells. And so this is a human organism that will simply mature if we leave it where it is. Whereas the way I understand it with things like tumor cells, they will multiply, but it's not an organism that coordinates its growth from within. And so that's the difference, is that the one is human parts, whereas the other is human whole. And so that's why the one gets human rights and the other doesn't.
Thank you, Maaike. Professor.
If being human is the marker of having rights, I don't see why human tumor cells wouldn't have rights.
Thank you.
But that's why being human isn't the marker for having rights.
And with 51 seconds to go, a new record. Is your question for Professor Sumner?
Yeah, it kind of segues into what you were just saying, but since it's fuzzy and arbitrary to pick a morally acceptable point in a fetus's life to end it, just like it's fuzzy and arbitrary to pick which animal has a good enough conscience to have the right to life, why can't we say that both animals and humans have a right to life simply by virtue of being life?
Professor Sumner.
That's tempting, but I think it probably goes a little farther than most people would. You could base having rights or having serious moral status on just being alive, but then you'd be distributing serious moral rights to every living creature, animal or plant. And while I'm certainly prepared to take seriously the idea that other animal species have serious rights, I don't think that my geraniums do.
Thank you, Professor Sumner. Maaike, your rebuttal.
I just want to quickly bring it back to what we're actually talking about, because I think Dr. Sumner answered your question. But when we're talking about abortion and human rights, we can have this philosophical discussion. I'm very glad to be here tonight. I think it's important to have this discussion. But I also think it's important to realize what we're talking about. Because when we talk about abortion, what happens is what we saw in the picture. I think people who come up with these ideologies often don't realize what the consequences of that is, and usually don't have to do the killing either. But the result of those kind of ideas is that human beings get killed, and I think it's important for us to realize that.
Thank you very much, Maaike. And we have one final question.
This is actually very similar to this one. Professor Sumner, you keep coming back to the idea that humanity itself is not good enough quality to differentiate humans from any other species. And I mean, we call eating other humans cannibalism, and yet we call eating animals, well, some of us do, okay. And I was just wondering, to you, what would be a good enough quality to differentiate humanity from any other species? Because it can't be sentience, because animals can feel pain and the like.
Yeah, Professor. No, sentience is what we have in common. However, I do think that in many respects humans are more important than many non-human animals, but I think that's because their capacity for sentience is that much more richer and more complex. We're capable of more complex lives, we're capable of much more complex, affective, sentient lives as well than most other animals are. So on that basis, I think that generally speaking, human rights are more important than non-human rights. But that's not, I mean, my point has always been that's not to deny that there are serious non-human rights, serious enough, I think, to make our practices, our normal practices with respect to animals, including eating them, seriously questionable. And if we take that into account, then we really need to rethink the way in which we interact with them. So I think, taking sentience as the baseline, as the marker, is quite compatible with holding that some animals are more sentient than others.
Thank you very much, Professor. Maaike, your rebuttal.
Well, that's where Dr. Sumner and I share a common ground, in that I would agree that we should think about how we treat other animals, and that whether we should eat them or not. But I think that we could all intuitively agree that there's a difference between whether or not we eat an embryo or whether or not we eat a cow, for example, and also that we would help the members of our own species before we would help them. So the claim I've made tonight is that if we believe in human rights,
then that should apply to all members of our species. And that it would be morally arbitrary to come up with a different definition or a different condition or criteria for why people should have human rights.
Thank you very much, Maaike. That concludes the questioning, and with that, the debate entirely. So I want to give a big thank you again to the organizer of the event, as well as to both of our panelists this evening, Maaike Rosendal and Dr. Wayne Summers. Please, a round of applause. To give a final official closing, but I just wanted to thank you very much for the opportunity to invite me. I've been Andrew Lawton, and if there is a spot on the forums for moderator, just put like excellent or awesome or use any superlative you'd like. But with that, thank you very much for having me. Here's Michelle again from Students for Life.
Thank you, Andrew. You're an awesome moderator, actually. I would really like to. I'd like to take this opportunity to thank Professor Wayne Sumner and Maaike Rosendal for all the time and effort you guys put in to be part of this debate. And on behalf of Students for Life, we have a small token of appreciation. It's not big, but it's something. Thank you so much. Thank you, Professor Sumner.
Check for a large amount, right?
And also for Andrew, of course.
Thank you.
And of course, thank you everyone for coming and for participating with respect and in a nice way. Please don't forget to do the feedback forms that you received before the debate and hand them in to us, to Corinne, who's at the door, or to give it to me or Diane with the blue scarf before you leave the room. Also, if you're interested in these kinds of events or interested in becoming part of Students for Life, which by the way consists of amazing people, like me, I guess. Please feel free to sign up. We'll have a sign-up sheet in front, and you can join our mailing list so you can get more updates, or just to get invites to these kind of events. Also, you can ask any of our execs, so me, Sarah's also there, vice president of our club, if you have any questions about the club. And that's all for tonight. I wish you a safe trip home. Thanks so much.